Hello, ALS employees. This is Nick Cianci, President of Compass Total Benefit Solutions, and I'm excited to talk to you today about the 4 new medical plans that are going to be offered to you by your employer. The first plan that we're going to be talking about is a MEC plan. For those of you that have never heard of a MEC plan before, it stands for Minimum Essential Coverage. MEC plans typically cover your preventive and wellness benefits only, but our plan goes above and beyond that. So your wellness visits are covered at 100% per ACA guidelines. This would be your annual physical, proctology exams, mammography exams, things like birth control pills that cover it at 100% as well. For a full list of what is covered at 100%, you can go to this website listed here under healthcare.gov for wellness and prevention services. Our plan also covers both acute doctor visits and behavioral health services through telemedicine services. These come through Clever Health and Teledoc, and they are free and unlimited for members to utilize. In addition to that, we do have some PPO network services that are being offered here through PHCS as well. So on the right side of the screen here, you will see there are limitations to the visits, but unlike other MEC plans out there, these are first dollar benefit coverages. So you will pay $20 as a copay to go see a primary care physician in network for a sick visit. Same thing with a $50 copay for a specialist and $50 copay for an urgent care or walk-in clinic. Those services are limited to 3 visits per member on the plan per year. There's also 5 x-rays or labs that are covered at a $50 copay, but those need to be in offices, not in the hospital. Same thing with your CAT scan or MRI. That's in a freestanding facility, not in the hospital itself. In addition to that, we do have some pharmacy coverage here. Now, this is a basic pharmacy plan. You're going to see 3 tiers here. Your $1 low-cost generics are going to be things like your amoxicillins, penicillins, generics that have been around a long time. You will pay $1 for those again. That is up to a 30-day prescription. And then your generics and preferred, your tier 2 and tier 3 services are covered at a 10% coinsurance and a 20% coinsurance. This plan does not cover insulin. It is not going to cover chemotherapy drugs or any major medications like that. This is for basic services. Typically somebody that does not have ongoing sicknesses, but might need to go to the doctor every once in a while. In order to look up a provider, you would go to multiplan.com, find a provider, click OK in the top right-hand corner, select the network of PHCS, and then select specific services. That will allow you to then type in the type of service that you're looking for, and then the zip code. This will bring you to a 20-mile radius of the zip code with in-network providers. You could also call 888-371-7427 for additional help here. The next 3 plans we're going to be talking about are the Compass MVP plans. MVP stands for minimum value. These are stepped up benefits from the MEC plan itself. Again, you still will see some limitations in here though. Please note that all of our plans do have no deductible whatsoever. Again, they are first dollar covered benefits. All 3 of the MVP plans do cover preventive and wellness the same way as the MEC does at 100% for in-network doctor services. But as you can see here in the basic plan, there are 8 visits per year for primary care sick visits and 8 specialist visits as well. The Plus plan steps up to 10 visits for primary care and specialist visits. And then our ultimate plan has unlimited visits for primary care, specialist, urgent care, among the other benefits itself. So you can see that there are stepped up benefits in comparison to the MEC here. In addition to that, the pharmacy benefits are generic only for the basic plan. Preferred brand and non-preferred brand drugs are covered under the Plus plan and Ultimate plan. So there is a more robust formulary there. All 3 of these plans will cover insulin and diabetic needs, as long as the insulin is generic for that for the basic plan, since it is a generic only formulary. In addition, there are hospital services that are covered under the MVP plans that are not covered under the MEC services. So as you can see here, we will have certain hospitalization limitations on the basic and the plus plan. The ultimate plan does have unlimited hospitalization services at fairly low copays. I can tell you from the basic plan to the plus plan, there are also pregnancy services added. So the basic plan, if you see a slash here, chemotherapy, colonoscopy, dialysis, DME, hospice, all of these are non-covered services under the basic plan. On the plus plan, it does add the professional services, maternity, childbirth, and delivery pregnancy services as a copay here. The ultimate plan, again, has unlimited benefits from this perspective. All of these plans utilize the PHCS network for the medical benefits up here as well. Instead of the specific services, you would go to the multiplan.com website, select PHCS, and then select practitioner and ancillary network. That would allow you to find both the doctors and freestanding facilities. The hospitalization services have an open network. That means you can utilize any type of hospital out there. There are no network needs, so you can feel free to go any hospital in your area. If you have additional questions, you can feel free to reach out to me directly. Again, my name is Nick Cianci. My cell phone number is 860-416-5333. And my email address is nick, N-I-C-K, at compasstbs.com. That's COMPASSTBS.com. And you can see it on the bottom of the screen here as well. Thank you. Have a great day.